So now that we know what the clinical symptoms are, how do we diagnose this condition in clinic? Often we use a cluster of tests. The first test that we would do is actually having a feel over the bone on the outside, so the greater trochanter or the gluteal tendons, to see whether the pain that is elicited similar to what the patients are feeling. Um, there's also the Faber test, so flexion, abduction, and external rotation test that you can actually see here in the picture. So we will perform this test and ask the patient whether they are getting symptoms on the side of the hip. We'll often make them stand on one leg for half a minute. In this case, we will ask them to stand on affected side for 30 seconds, and we will ask them whether it reproduces the outer hip pain that they feel. There's this test called the Fader-R test, so flexion, adduction, external rotation, resisted. So the test would look a bit like what you see here in this picture. So the clinician would bring the patient's knee towards the patient, bring it across the body and apply a rotational force and get patients to actually resist that force to see whether it reproduces any of that hip pain. The last test that we always do is to put them on their side, get them to push out sideways and to see whether it reproduces the pain on the side of the hip.